Why has Boris got it wrong? 0344 499 1000. I think that perhaps the best place to start, just to give this some semblance of context, think back to Thursday last week. Pizza Express saying it would make another 1,300 staff redundant. That's on top of the 1,100 they'd already announced. This list could go on for the next half an hour, of course, but let's just take some of the bigger headlines over the last months. British Airways, 12,000 jobs gone. Rolls-Royce, 9,000 jobs gone. Marks and Spencer's, 7,000. Premier Inn, owner of Whitbread, 6,000. Britain's economy, of course, contracted by 20% in the first half of this year. We surely cannot afford another national lockdown. We're heading for 3 million people unemployed, some say more, by Christmas alone. Why has Boris Johnson got this wrong? 0344 499 1000. It's interesting just looking at the numbers. It depends on which figure you read. About 60,000 people might have died with COVID. The average age is 82. Oddly, that's a year longer than the average age to die anyway in the UK. Almost half of all deaths, by the way, have been in care homes. So I was intrigued at the weekend to spot the graphs at the press conference at Downing Street. This was the hastily cobbled together press gathering where the trio of doom made their grim announcements and predictions. We all saw the charts, the peaks and the peaks. There are very few troughs. The bell curves were coming off the page. And the most troubling headline, I think we can all agree, that came out of that was that deaths from COVID would peak at 4,000 a day by Christmas. And there was a sort of an area of the shaded area suggested the possibility of an even higher death toll of 7,000 a day. And I looked at these numbers. I thought, well, hang on. 4,000 deaths a day, 7,000, given back in April in the peak. It was just around about 1,000 a day. And the government's previous worst case scenario suggested a peak of 850 deaths a day. I mean, it looked absolutely horrifying. Where did this number of 4,000 come from? Come from 850 to 4,000. Well, let's find out. Let's look at the source. Because they'll always put the little source on the bottom of the graph, right? And I tried to look, but I couldn't see. Even on my plush flat screen, I couldn't quite see. But if you look at those graphs online, you get the picture. I thought I was the only person that had spotted this. Thankfully, a journalistic colleague over there at the Telegraph said the same thing. The small print at the bottom of the graph, which you cannot see on the TV, but you can see when published online, says this. These are scenarios, not predictions or forecasts. And there was no source listed for the graphs, by the way. We were told they came from a number of academic modelling groups. How do you get away with that? It's a Downing Street press conference. The Prime Minister is heading up a press conference, urgently put together after a leak. A leak, I think, rather than a briefing. There is a distinction. And clearly there was an almighty brouhaha going on, I would imagine, between Mr. Johnson and Mr. Sunak. Who knows? Hence the delay. And suddenly, the numbers of 4,000 deaths a day is announced at a press conference. If a government scientist or a government clinician is going to give me that figure, I think I have a reasonable right to know where it came from. What is the source of that? I mentioned Professor Sunetra Gupta when I was talking to Mike earlier, who's been wildly and widely criticised for her assertion that actually we should be easing lockdowns, letting people get on with their lives and shielding the most vulnerable. And the main argument that is thrown at Dr. Gupta is that where's the evidence for what she says? Where's the peer-reviewed evidence for what she says? And that seems to be the big bone of contention. And of course, we spoke to her just last week on the programme, and she gave us what I thought was reasonable explanations to how she'd drawn or come to the conclusions she had. Nonetheless, the very same people that are advocating that you cannot wheel out stats and facts and data without any corroboration are now just plucking a figure of 4,000 a day and not actually giving us any reason as to why it's 4,000. It was almost as if it was intended to shock. Why has Boris Johnson got this wrong? 0344 499 1000. We've subsequently learned, of course, that the most frightening curve, the 4,000 a day, was the work of Public Health England and Cambridge University, but it does not seem to have been published anywhere. So I looked for this, tried to find it, couldn't find it anyway. Essentially, we've got no idea what assumptions have gone into the 4,000 deaths. It doesn't, as the phrase goes, pass the smell test. So on Saturday, Public Health England reported 278 new COVID deaths. Now, the average number of deaths for the past 7 days is 214. That's up 50% on the week before. If deaths kept rising at that rate, then yes, you would get to 4,000. But that isn't the measure, because the better guide of future deaths is the figure for new infections, which of course tends to lead to the death figure. Over the past 7 days, Public Health England recorded an average of 22,500 new cases a day, which was 6% increase on the week before. If deaths followed that trajectory of new infections, and surely they must, unless COVID-19 suddenly mutates into a vastly more deadly form, there'll be nowhere near 1,000 deaths a day by Christmas, let alone 4,000 deaths a day. So on that basis alone, there is something suspicious here. The figures, of course, for new infections clearly show a slowdown in the increase in new infections, but you wouldn't have gained any of that from listening to Whitty and Vallance on Saturday. 0344 499 1000. I don't want to believe my Prime Minister stood up at Downing Street, and this is a Prime Minister that I would suggest that in his heart would not want to be somebody who would want to close down the country, which goes in his defence. If he's willing to do it, there must be good reason behind it. But what is that reasoning behind it? And by the way, I'm not suggesting there isn't. I just haven't seen it. And I feel, as a citizen of the UK, as a taxpayer in the UK, as an interested party in the UK, and I think I speak for all of us on all those points, I think we have a right to know why a Prime Minister is closing down a country and an economy, because that's what's about to happen in around about 60 hours' time. No data, nothing to corroborate the figure of 4,000, and even based on Public Health England's average of new cases, that figure doesn't add up. So where did they get it from? I'd like to know. Now, the counter-argument to all of this is whatever you think about, figures, schmiggers, whatever you think about that kind of caper, the reality is that as of today, we have 10,918 people in hospital. Although, just to slightly counter that, as Mike Graham was saying earlier, the people who've been admitted to hospital doesn't mean to say there are 10,918 people laying in hospital right now. We do know there are 978 people on ventilators. So let's just take that figure alone. We know that factually there are 978 people on ventilators in the UK and the system cannot cope. So if it is based solely on the system not coping, then does that change your mind on what you think of what Boris Johnson has said? Regardless of whether you look at that graph or take that piece of data or that piece of research, the bottom line is that we have nearly 1,000 people on ventilators in UK hospitals. Something has to give. You can't keep up that kind of rate because hospitals will be overrun. So for no other reason, not about people not getting, the average fit person not getting COVID, it'll go through most people, they won't even know, we're aware of all of that. But actually, the fact is, some ICU units have half a dozen beds in them, maybe 12 beds. You get suddenly 6 people taking up those beds, and they're not there for a couple of hours. They could be there for many, many weeks, possibly longer. Then you have a problem. So does that figure convince you? The ventilator figure alone. Forget the admissions, because that could be people who've gone in, got a bit of treatment, come out again. Not necessarily languishing with COVID on a ward somewhere, but people who've gone in. I can't break that number down. I don't have that data. Unlike the government, I'm not prepared just to give you a scenario. I'd rather give you the facts. The one fact we do know is that 978 is the number for those on ventilators. Does that change your view? So this lockdown happens for no other reason than space in hospitals. And by the way, I don't think I'm the first to raise this. What's with the Nightingale hospitals, by the way? Remember that? It's a big old place. How many patients, Ricky? 4,000 or something? 4,000 it's meant to take? 4,000? Are they closed? Are they waiting for a locksmith to come out because they lost the key? What's going on over there? And there's 6 of them, I think, in the UK. About 6? Half a dozen Nightingale hospitals. Where are they? So we're told that 5 emergency hospitals with the capacity to treat almost 10,000 COVID-19 cases. 10,000 of those Nightingale hospitals. 10,000 cases. So that's a fair amount of people. These, one would assume, are people that would need the most intense treatment, right? I'm assuming. 0344 499 1000. So I've just got confusion at this end, that's all. If all of this is solely based on ICU, ventilators and people in that position, this doesn't make a good scenario, by the way, because you've still got all the Nightingales. What's the deal with those? Then perhaps I can begin to understand one of the figures. So help me understand the figures if you could, because I'm just trying to follow the science, the real science that we know, and it doesn't seem to fully conclude in the way that Mr. Whitty and Mr. Vallance told us at the weekend. A governmental press conference wheeled out not data, not facts, but scenarios. And that should be a shameful day down there at Government HQ.